Hi everyone, this is Dr. Gordon Koo and I'm here with cosmetic nurse Tanya. Hello Tanya.
Hi everyone, how you going?
Okay, now it's a lovely Sunday, so we're just gonna have a quick chat about non-surgical nose lift. And just a quick word about me. So I'm a board certified cosmetic physician and liposuction surgeon. So I also teach for quite a few different organizations, including the Australasian College of Cosmetic Surgery. And I am also a faculty trainer for an international anatomy society called I-Class Anatomy. So I have a lot of interest in anatomy and also non-surgical thread lifting and advanced cosmetic injections. So I just want to introduce you to cosmetic nurse Tanya. She's also based in Melbourne and she has a lot of experience. I'll let you introduce yourself, Tanya.
Hi everyone. So I'm Cosmetic Nurse Tanya and I've been in the industry for about a good 7 years injecting solely, but I've nursed for about 18 years. I do have an interest as well in the anatomy and in advanced treatments that are related to sort of these sort of treatments. I do like to focus a lot on the profile balancing and the liquid nose jobs, the non-surgical runners. And I find I find all of that quite interesting in the fact that what led me to cosmetic or the aesthetic world is that I did work alongside a lot of doctors who were in dermatology or had related to skin. So that sort of sparked the interest in getting my degree and postgraduate in dermal science. And here I am.
Fantastic. I really like what Tanya does about the liquid nose with the liquid rhinoplasty. So we're going to talk about that. And so this session, we're going to talk about the non-surgical nose lift. So a few things we're going to cover. So why do people want to change the appearance of their nose? What treatment options are out there? And then we're going to talk about fillers versus threads to the nose.
It'll be a little healthy debate.
So why do people want to change the appearance of their nose? Well, we're all born differently and we all have very unique features. So actually, Tanya, you want to have a look at these nose features?
Yeah, so I really like this slide that you've got. And it does show a lot of the celebrities and how they're all quite unique themselves and how these sort of insecurities that we have, they're actually okay with, aren't they? Like it works for them. Like you've got the larger nose there, the bony structured, and obviously a lot of people do follow Bella Hadid and are kind of after more of that nose. It's a little bit upward turn, but it's a great slide to show all the different noses, and they're not always bad, are they? They're not always an insecurity for most.
That's right. I mean, I quite like that scooped up nose look.
Pretty cute, yeah.
I actually had a patient, which I'll show you in one of the photos later on. That I actually had a patient that she didn't like that look on herself, so she wanted me to straighten that up. So everyone's
Wow.
different, everyone how they feel about their appearance. Everyone's different, and I think nose is a very personal thing. And
Yes.
so if you have a look at these photos, I actually never really notice. I didn't realize that Paris Hilton, until I looked at this photo, that she actually has a very downturned tip.
Yes, these are really good ones that you've picked out as well. Like with Paris Hilton, I have noticed it, but it works for her, doesn't it? Because she's got all these other harmonious features and her nose doesn't really draw any attention to her face at all because it just all works well together, doesn't it?
That's right. That's right. And Sandra Bullock, she has this cleft tip on the nose. That was never
She does, but
something I
again,
really
she's got all
noticed.
those other features that kind of work well for her. Now the interesting one is Owen Wilson, isn't it? Like he's got probably the most crooked nose in Hollywood. but it's just a feature. It's him, and I feel like if he didn't have that, it just wouldn't be him, would it? Like,
Mm,
it just works for him.
that's right. That's right. And see this celebrity here, she's got the round
More of
bulbous
that
tip,
bulbous
you know.
tip, yeah.
And some of my patients don't like their bulbous round tip.
Yes,
So,
I get a lot of them myself. Yep.
yeah. Okay, so these are some of the presentations that we get, some of the complaints that people come to us that they want us to fix these. Sometimes it's an asymmetry, sometimes it's a bump on the nose bridge, sometimes it's,
Most common, I think, is the bump on the nose
yes,
bridge, isn't it?
that's right, that's right. And some people want their nose bridge higher, some people feel their nose bridge is not well, it's not defined enough, they feel it's too flat. And a lot of my Asian patients would like their nose to look a bit more westernized.
Define.
And some people feel that nose bridge is too wide, or the nose tip's too round, or nostrils too wide. And we talk about downturned tip. And sometimes people have like a little indented, just indented on the side of the nose.
Just above the nostrils, yep.
Mm. So what are the treatment options out there? So there's surgical, which is the rhinoplasty treatment, which I don't do. There are plastic surgeons and aesthetic ENT surgeons that do these surgeries very, very well. And Tanya and I do the non-surgical treatment. Tanya does a lot of fillers. I do a lot of the threads to the nose. And I actually do a combination of both fillers and threads. And I'll explain why I do both. So, and I'll let Tanya talk about the filler injections to the nose. So
Yeah.
basically, do you want to talk about this, Tanya?
Yes, I'll be happy to. So I always start with a consultation. Let's get that out of the way first. So this is probably being the most advanced treatment. You must book in a consultation first to discuss the risks that are involved with dermal fillers to the nose. But the technique used would be, I always reassure clients that I will do the treatment very slowly. It'll be one of the treatments that I do inject super slowly for the reason to minimize risk of complications. And if there is one, then we identify it nice and early. Smaller amounts of HA filler are used into the thank you, into the basal bone, and just applied, depending on sort of what the concerns are, would address to give the projection or to lift the tip, or, you know, the asymmetry, whatever needed. So it would be very small amounts at a time and assessing throughout the whole treatment. A small amount goes a long way with the nose filler as well. So moving on to the tip of the nose as well, and yeah, sorry, to lift the tip as well.
Yeah.
Here are a couple of my before and afters using the HA dermal filler. As you can see, the tip is lifted, the more defined structure of the nose, the humps are disguised as well. So we're injecting around the hump, never on the hump, just to minimize the appearance of it. And my most favorite one is the far right one, where we were talking about the indentation above the nasal, the nostril, sorry.
This bit here.
And yeah, so that is a high risk area to treat, but
Mm.
as you can see, once treated, it just gives this more harmonious appearance of the nose, and it appears smaller. I always get asked, how do you inject filler and the nose actually looks smaller? That's the $1 million question.
Mm. Yeah. Actually, let's come back to that, because we're gonna talk about how we address all those concerns.
Yes.
So I just want to talk about the anatomy a little bit around the nose. So there's actually a lot of blood vessels, arteries, all connected around the nose. And if you have a look at this, especially this artery here called the dorsal nasal artery, that's an artery that goes from inside the eye socket, and comes out and gives a blood supply to the nose. Now, this artery normally sits on the side, on either side of the midline. So when you, generally speaking, when we inject on the midline of the nose, it is reasonably safe. However, it's relatively safe, but these arteries can pretty much go everywhere. And because it is connected to the arteries inside the eye, so if the filler is injected into the one of these arteries and at high pressure, and that blob of filler floats into the artery and then goes inside the eye, it can cause circulation issue to the eye and causing blindness, which would be the most severe and detrimental complication. Having said that, it is extremely rare, and so we don't want to cause any circulation. And touch wood, I've never caused any circulation issues.
I touch wood each and every one, promise.
To deal with any
and it is
I've done.
With the consultation process, and I do say, you know, it is a very small chance of it happening, but it is a high complication that we need to consider. And I do sort of follow through with that, if in an event of the emergency, what my emergency protocol would be. So I do cover all of that grounds with each and every client.
I mean, if it's a circulation issue to the skin, we can probably reverse that with a dissolving solution called hyalase or hyaluronidase. But if a bit of filler goes into the eye, so far, most of the time it's not reversible. So just, yeah. And so blindness from filler injections they've done surveys recently, and it's about 1 in 300,000. And if you have a look at this chart here, where the blindness cases come from, most of the cases come from this central part of the face injection, so nose and glabella. So this part here, especially up here above the bridge of the nose, the high up in the bridge of the nose, that's where there's a very high risk area for blindness. So this is why I would prefer to use threads up here, even though down here I sometimes still use a little bit of filler to the nose tip, but it is less risky. And but a lot of that, it does depend on your injection techniques and things like that. So
I think there's been one case in the past 10 years of blindness. So it is an extremely small chance of it happening. But again, you need to be very quick-witted with, if there was a complication, to dissolve as quickly as possible.
That's right. So moving on to the threads to the nose. So I insert threads usually from the tip and upwards, and I use usually the European threads, not the Korean threads, because I use the European, usually the Aptos threads that have the barbs on the barb threads, so which they're locking very well, and they're also made of a material that lasts a lot longer than the PDO threads. So the smooth PDO Korean threads, they tend to move and they don't last very long. So the PDO Korean threads tend to last about usually 6 months, and they tend to move. If they do move and sort of poke at the skin, it can cause a little lump. And that's why I generally don't use the Korean threads for the nose.
And how long do the threads or the treatment last for most of your clients? So
these threads, the threads that I use, they stimulate collagen, so they usually last about 1.5 to 2 years, usually about 2 years.
Pretty good.
Whereas the Korean threads, they dissolve very quickly and they don't stimulate collagen.
Okay, interesting. And do they not have the same sort of barb technique as the ones that you use?
Most of the Korean threads don't have the barbs for the nose.
Yeah, for the nose. Yeah.
So there are ones that there are different Korean threads now. Some have the barb, some don't have the barb, but you really need a specialized sort of threads with barbs to go into the nose to lock in properly. However, the It really is the material that matters in terms of duration, because that determines how quickly the threads get dissolved.
Okay.
Yeah, because the PDO threads get dissolved very quickly. I mean, I know a lot of nurses now are using the little PDO monos for skin.
Yeah, I do those.
Yeah.
Yeah. And they
And you
dissolve
find
after
that
3
I think
months.
they're fine for skin tightening and support.
Yeah.
But you'll find that I've asked the Koreans how long they last, and they told me 6-7 months.
Okay, interesting. Yeah.
Yeah.
Yeah, I know the monos that we use, they're to dissolve at 3 months, but they've, done that whole stimulation in the collagen production turbocharged in that time frame. So don't know if they're the same though.
Yeah. So the threads, maybe the TDL threads probably gone maybe 3-4 months, but there's still some collagen.
Yes,
And it's a different
production.
type of collagen that TDL threads stimulate compared to these threads.
Yep.
They stimulate different types of collagen. So that's why the PDL threads stimulate the type of collagen that don't last as long as well. So that's why they're a lot cheaper, the PDL threads.
Makes sense.
So the same. So I'm using the threads to fill above the bridge. So see this girl here, she had a little bit of divot. So I actually inserted threads above the bump. So instead of putting filler there, I put threads there.
Interesting. And how many threads would you put per client?
It does depend on their skin tightness and how much of a divot they have and things like that. So it'll be a minimum of, see, these threads are quite long. So each thread would go up and down about 3 times. It will be 3 passes. So if I do 5 of those threads, it's like 15 layers.
Oh, wow. Okay.
Yeah. So if I do a whole like 10, it'll be 30 layers. So I do my patients get a lot of value from that. So I mean, this girl here, she only had a very mild bit of a divot there. So I end up putting the short, I think it was 5, but it's only short distance. So there's probably 2 layers per thread. So there's about 10 layers there.
So if you only had to correct sort of that area there, do you still go from the nasal tip?
No.
Okay.
But in her, she also wanted a bit of a lift.
Yeah.
Yeah. She also wanted, I don't have a front shot. She also wanted a bit more definition front on as well. So, yeah. Now, this girl, she's got this scooped up nose, which I actually think is okay.
I think it's cute. Yeah.
I think it's cute. But she herself, she doesn't like it. So,
Yeah.
So I've put threads up there. So, you'd probably use filler to just fill.
Yes, correct. Yep. Just to create that definition. Yep. And
Whereas,
that projection.
Yeah, I use the threads to fill like that.
Nice.
So just a quick summary. So Tanya does the filler, consultation, and treatment about 30 minutes. And that's the pricing. And filler lasts roughly about a year.
About 12 months. I find some clients might need a sort of 6 monthly tiny top up, just especially if there's a lot of divots or indentation in the nose, so they might just see it dip a little bit. And especially I find clients who wear a lot of glasses, so they might come back for 6 monthly top up, just a smaller amount than the first treatment, but generally last about 12 months. Yep.
And so I spend usually about an hour. I talk to my patients. Like usually I do a consultation first, and then the actual treatment usually takes me a bit under an hour, and because I have to inject a tiny bit of local anesthetic at the tip, and then push the thread up. It's not painful, but it is a bit more, I guess, fiddly than.
Well, while you're on that as well, with the nose filler, the product comes with lidocaine in it. So just important to note to clients as well with that one. So it's generally quite a comfortable treatment.
I mean, overall, I do feel I mean, I think Tanya does a fantastic job, and I think her nose filler job's really, really good. I do feel in general, like not just Tanya's treatment, but I feel for general people out there doing filler injections, I think the threads, from my experience, they seem to look a little bit more like they just look more natural because they seem to integrate into the skin. But I think your results look very, very natural too, Tanya. But I know that just because the way you inject it, like you do your little uh,
A little
little boluses,
si-
which is nice. But I do feel I have seen some other people's injection with filler that just have like a bolus here or be too wide.
Yes. Oh, I've seen that
Um,
too. Yes. So it's really
uh,
important. I
yeah,
think that's what you're trying to say is do your research, check a lot of before and afters. And I think it's important to also have other modalities. Some people might not want to go through and risk blindness, and that's where threads come into the play as well. So I think it's important to be able to have different modalities out there, which there are, and it's important to have do your research and have that person that you trust, have that rapport with the person that you're going to do your treatment with.
that's right. That's right. And the other thing, I'm not sure. I've seen a couple of people where they've had filler here, and then I think they wear glasses or sunglasses, and the fillers got pressed down, and it sort of got. Have you seen that?
Wider.
Yeah,
Yeah,
you've seen that.
I've seen that, and I've seen it early days of when I was injecting, and I can think of this person, and I just feel like they had a really badly job done. And then nobody sort of felt comfortable enough to say, but then they got it dissolved, which is good. So it looks a lot better. So again, well, that's where doing your research and your consultation is so important, because you can appear worse than where you started.
So how do you prevent that from that if you don't feel it there? How do you?
Injection technique and
Hmm?
amount.
Sorry.
Yeah, injection technique and amount used of filler. So I find you don't want to overtreat. And I do tell my clients sometimes or most times progressive treatments are needed, and the result will always look better with your progressed treatment. So the second time, like you'll be wowed with your first treatment, but you'll be super pleased with your second treatment because and what I explain again in my consultation is the filler will then integrate with the tissue, and the tissue will literally hug the filler around and create that more of a softening. So it might look a little sharp at the beginning. And again, and I never over treat my nose, I under treat with room to add a bit more if needed. And that's where I find your example that you just pointed out is somebody tried to get there too quickly rather than treating slowly and progressively.
Okay.
Yeah,
So I tend not to have that problem with threads because the
yeah,
threads I use have barbed and they're locked in there. And
yeah,
then whereas the filler is a gel, that can move. And
correct.
so with the threads, it's one treatment, and it gets locked in, and they're just locked in there, and they're not going to move around. So
So with the
yeah.
filler, it is likely to move if you inject too much too soon, is what I say.
Mm,
So I inject small amounts, and like I said, the tissue will integrate with the filler. And what I explain to clients is if we go too fast too soon, it's kind of like jelly, and then you're injecting jelly on top of jelly, and it's going to splat. So allowing that time for the tissue to integrate with the filler is actually providing more of a structure, and then we're able to inject a little bit more filler on top, which will then hug a little further down the track, and then you've got a really good structure of the nose. So
yeah.
definitely not over treating, and then progressive treatment is where you're going to. So I do have some clients, especially like how you explained before about the westernization of the nose. So they're the clients that I always say we're going to get better results over time. And so that's where I might just do 500,000 at a time each treatment every sort of 3 months until we get to where we want to reach the goals. And then you will have better structure. Otherwise, injecting a whole, say then I know that they need 1.5 million, but injecting all of that in one go, one, increases risk of blindness and complications, but two, there's chance of filler migrating because of that. There's no room to go, there's no structure. and it will just splat. And I've luckily I haven't had any issues with that, but I could imagine that's where that whole jelly effect would be. If you put too much jelly on top of each other, they're going to end up sort of splatting.
That's a very good point. Okay, yeah, thank you for that. That's good. All right, so lastly, yeah, worst case scenario for filler, it can cause blindness, but even though it's a very, very rare chance, threads, worst case scenario, can cause infection. Again, I've never seen it, and usually can be treated with antibiotics. So I usually give a course of preventative antibiotics anyway after treatment. Granuloma is a chronic inflammatory reaction which causes a red nodule. The way I do these hasn't happened on any of my patients. It can happen on threads that move, that can cause a bit of a red lump, and I've seen that on other types of threads, especially.
And what's the treatment if there is a granuloma?
Okay. If it's granuloma caused by thread poking at the skin, that piece of thread needs to be removed first, and then that granuloma, that red lump, needs to be treated either by shaving it off or injection of cortisone. Yeah, it's not easy. That's why.
We just hope that it doesn't happen.
Okay, I'll just very quickly just go through these common presentations that people come to us for, and then like see how I would do it and what Tanya would do. So asymmetry, say someone has like their bridge is a little bit bent to one side, and what would you do, Tanya?
Yes, so I've had a couple of cases of that. So I always draw up when assessing the client with a white marker where the asymmetry is and where I need to inject and where I need to avoid. Obviously, if I inject into an area that's already larger or bulbous, then I'm going to make that worse. So I sort of put my markings of where I need to inject and try and mimic the other side. However, there are cases that I've had where the asymmetry is quite significant, and I will make a mention and just make sure that the client's okay with that, especially when I've had huge bumps to the nose at the bridge area, and I just say, look, I can disguise it, I cannot give you a surgical result. At the end of the day, we do have to remember this is non-surgical, and give you the best outcome in the non-surgical treatment.
So the way I would do it, if someone has like a bend to one side, I would fill the other side with threads, and I would just straighten that out with it will make it straighter. Bump on the nose, we've talked about this. So Tanya, you probably feel above the bump.
Above and below.
Above and below the bump, yeah. Yep. So I'm the same. I would feel above and below with threads. Yep. If nose bridge not high enough, yep. So we've sort of talked about this already. So Tanya will just probably do serial injections of filler.
Right. Just down along the bridge,
yeah. And I would use threads up and down the bridge.
Yep.
And same with the nose, being too flat or westernization.
Yep,
that's
exactly the same. All those three are pretty much the same. Yep.
Now, nose bridge being too wide.
Tricky one.
Yeah.
Tricky one, because you've got to also assess projection. So if they're too wide and too projected, well, that's a tricky one, isn't it? We'd have to assess also how is it hooked, and very rarely, but sometimes I will just end up having to refer them on for probably surgical intervention. I refer them to you if they if they want to look at
yeah, exactly. I mean, our treatment with the filler and the threads, we're not going to reduce the width realistically. However, by giving the bridge more definition, whether with threads or with filler, or extending that bridge length with filler or threads, it can give the illusion that the bridge looks narrower, without actually reducing the bridge width. And that's what I explain to my patients. So,
and sometimes a tip as well. Yeah, creating a nice little tip.
That's right.
That might create that narrower looking nose.
So it's like, because you say if your bridge is this short and it's this wide, so but if you can extend it to about this, it looks less wide.
Yeah. It's all a disguise.
Hey.
It's all a disguise.
Yeah, that's right.
It's a mirage.
Yeah. Nose tip being too round, again, I can't reduce like the size of the tip, but we can add to the tip a bit to make it pointier.
And the bridge, sometimes I find attending to the bridge with this one helps a little as well.
That's right.
Yeah.
So by giving that more definition on the bridge, it makes the tip look less round.
Yeah, more narrow. Yeah.
Yeah. Now the nostrils being too wide, what do you do about that, Tanya?
Oh, this is a tricky one. I have had, let me start again. I have injected filler into the nose if the nostrils are looking too hollow, to make them appear smaller. So this has worked. And that's just by, again, injecting around the nostril, and it doesn't make it appear more narrow.
So what do you inject?
Filler, HA filler. So in around the nostril to make it look smaller. So the nostrils to appear smaller. Yes, we have done that, and it has worked.
How much of a reduction do you get from that?
Significant enough. Yep. Sometimes I do have to come back a couple of times.
The edge of the border of the
border of the nostril. Yep.
To basically
to make it appear smaller.
You basically make the borders bigger, but make the holes less
smaller.
Okay.
Again, the disguise. It's the art of it, isn't it?
Yeah, a patient asked me to do threads there once, like just
that would be so tricky. Yeah, I think that's where HA comes into.
That I think it's much easier with HA. I think. Yeah, I do usually with the tip. Just while we're talking about the tip, sometimes I'll tell my patients like the threads are great for the bridge, and a lot less, like a lot safer for the bridge. But for the tip, in terms of lifting that tip, I do tell my patients sometimes I do need to combine it with a bit of filler.
Yeah.
At the tip still. And like, for example, the next one is the downturning of the tip. Yes. I think the threads, like I still do put a bit of threads there. I know when I do threads, and to give that some support first. And then in some people it does help. But some people, they do need a bit of more help with the filler.
Yeah, I find, especially because doing the nose filler, I do use the highest G prime product, which means that it's a lot more structured as well. That's right. You can create that support to the nose tip to lift the tip. Yeah. Yeah,
I use that too. Yeah. Just out of interest, when you do the nostrils sides, do you use the high G prime filler too?
I still use the same filler. Yeah.
And okay, lastly, the indented on the side of above the nostril.
Yes.
On the alar of the nose.
Alar of the nose.
So what do you do? Do you use filler?
So, still use filler, and I super pray with this one because this is an area that is a higher chance of complication. Yeah, so you got your arteries, so you've got your chance of occlusion of vessels, or even just pressure onto the vessels, and as well as so blindness complications with these areas as well. So it does branch out from the main facial artery as well, so, and branches into that area where we want to treat. So assessment is key, and amount is key, so very small amounts at a time.
That's right.
And have your highlights. I do have my highlights ready just in case, always. Right.
So I'm less scared because I use threads to fill that. So I'll numb around that, and then I'll just use my little threads to fill that, and I wouldn't have to worry about occluding a vessel or causing circulation issues with the threads, because the threads won't block an artery. So it is a lot safer.
And what about results though? Do clients get nice filament in that area?
Yes. So they do get collagen building up where it's indented.
Yeah.
Yeah. Okay, that's cool.
Very good.
All right. Well, thank you for the chat, Tanya. It's
My pleasure. I think that was a pretty healthy debate. I like that.
I don't think it was even a debate. It was
No,
I
no,
learned a thing or two too.
I know, no, I loved it. I'm so glad that we could do this.
Yeah,
Yeah, the nose
fantastic.
king, nose queen.
All right, awesome. All right, we'll
Well,
do this
thank you
again.
for your time. We'll do
Yeah, and
something else next time.
just for our audience, if you can have a look at our work on Instagram, and if you have any questions, feel free to message us.
Yeah, we'd love to have a chat with you.
Yeah. All right, take care.
Thanks, Gordon. Take care. Bye,
Okay,
everyone.
bye. Bye.